Hi, I'm Mindy Nguyen, a third-year orthodontics resident. Today I will be presenting teledentistry implementation during the COVID-19 pandemic scoping review. I worked on this study with a former dental student, Neil Fuochakun, and mentors Dr. Elizabeth Oni, Dr. Martin Lipsky, Dr. Frank Lucari, and Dr. Man Hung. I will first go over some background information for the study. COVID-19 started in Wuhan, China in December 2019 and quickly became a global pandemic despite lockdown in Wuhan to contain the outbreak. The virus rapidly spreads via human-to-human contact via aerosol droplets from infected individuals coughing, sneezing, and even speaking. The dental profession is at high risk for contracting the virus since their work includes working in the oral cavity and most treatment procedures produce aerosols. One way to reduce the risk is by reducing the number of patients going to the emergency department and dental offices, and teledentistry emerged as a key factor in triaging patients. Teledentistry utilizes technology to help patients communicate and provide care without direct contact with patients. The purpose of the study is to examine the implementation, challenges, strategies, and innovations related to teledentistry during the pandemic, beginning at the lockdown in March 2020 until the current end of the study in April 2022. The method was that this was a scoping review. We used PubMed and Google Scholar to search for articles with the following terms: teledentistry, tele-dentistry, COVID-19, coronavirus, telehealth, telemedicine, and dentistry. The inclusion criteria were that the articles had to be published from March 1st, 2020 to April 1st, 2022. The articles had to be in English, and we evaluated the articles for relevancy to the dental field and its specialties. For our results, after the search for the articles and exclusion of non-pertinent articles, a total of 32 articles were included. 9 articles were narrative reviews, 10 were opinion pieces, 4 were descriptive studies, 3 were surveys, 2 were integrative literature reviews, and there was 1 each of the following: observational study, systematic review, case report, and practice brief. So for our results, the implementation section included that teledentistry was used both synchronously and asynchronously for virtual consultations and often employed commercial applications such as WhatsApp, Skype, and Zoom. Dental professionals commonly use teledentistry for triage to reduce in-person visits and for scheduling and providing consultations remotely. Some of the challenges included the patient and clinician acceptance of teledentistry. Either the patients didn't feel comfortable with the technology, and the same could be said with the clinician. And having an inadequate infrastructure also was a challenge, again, with the technology. And there was issues with reimbursement and security concerns. Some of the strategies included training the clinician and the patients in utilizing these platforms, and then also making sure that these applications were HIPAA compliant. And some of the benefits included were providing care for patients during the pandemic and extending care to areas lacking access to dental care. And this is just the Prisma flowchart to show how we did the search, how many articles that yielded, and how we excluded some articles. And again, we ended up with 32 articles. So for the discussion, teledentistry helped maintain the continuity of dental care during the pandemic through various applications to help patients communicate their concerns via photos and videos. An unexpected benefit was it improved access to patients with disabilities or other barriers to in-person visits and access to specialists. A consistent barrier was the inability to perform diagnostic tests via teledentistry, such as palpation or thermal testing. And there was a need for clear guidelines and protocols by governing dental bodies for treatment, prescription, and dental codes. So in conclusion, COVID-19 pandemic lockdown led to new teledentistry implementations, mainly for triage, but it also included follow-up and non-procedural care. It improved access to dental services and reduced in-person visits. Some challenges included the insufficient technology infrastructure, lack of established protocols, and privacy concerns. Hopefully, these barriers will be addressed and teledentistry can improve and be used more frequently in the future. Thank you.